The flu season has arrived on schedule after it took a year off. Last year's flu season was the lowest on record. This year, we may be headed into a more normal flu season. Meredith Aldis joins us with why the comeback and how to protect yourself. Meredith.
Cindy, the flu is back this year, and doctors say easing up on preventative measures is the reason.
Last year, we were doing a lot more to try and curb the spread of respiratory diseases.
Dr. Jensen Hyde with Erlanger Health System says now that we've let down our guard, the number of people getting the flu is going up. Tennessee is one of 7 states with high or very high levels of flu activity.
But most people didn't even get a cold last year. And that's because masks work. That's because less exposure to people helps. That's because, avoiding indoor gatherings. These all curb the spread of respiratory viruses that are spread through airborne droplets.
Those include the flu and COVID, but they're caused by different viruses, the influenza virus and coronavirus.
They are typically upper respiratory tract type infections.
Although different, Dr. Hyde says COVID-19 and the flu have similar symptoms.
Fevers, chills, body aches, cough.
She says cases are rising for both. Her recommendation is if you're sick at all, get tested. And it's possible to test positive for both.
The more information you have, the better we can do the right things to prevent giving this to other people and to hopefully kind of slow down the rate of rise that we're seeing now.
She says the goal is to get COVID-19 to a level like the flu, where it occurs during a specific season and is predictable.
That's through prevention of illness, which is through vaccination.
The locations to get the flu shot or the COVID vaccine open up the WRCB app. Reporting live in the studio, Meredith Aldis, Channel 3 Eyewitness News.